All right. Welcome back, everyone, to another edition of the All Me podcast. It's been a minute, but I am back as your host, Brian Parker, Director of Education for the Foundation. And if you've tuned into this podcast before or really follow us on any social media, you'll notice a few trends that we tend to talk about on a pretty regular basis, that being dietary supplements, regulation, high-risk products, anabolic steroids, vitamin, a whole bunch of different things. And so what we're going to do today is join in with a guest that's going to try to tie all that together, which is going to be a big ask. But if anybody can do it, it's going to be my friend, Bryn Austin. Bryn, thank you for joining us today. I am not quite sure which title I should call you. I should probably start with Stripe Director. We'll get into that, but there's 4 or 5 other things I could call you. So for now, I'm just going to call you my friend. Then you're going to tell us everything that you do. But for now, I'll start with a couple thank yous. Number 1, for the work you're doing. But number 2, thanks for your time today. I'm looking forward to chatting with you.
Well, thank you. It's a pleasure to be here.
Yeah, I think this is going to be super fascinating and give everybody a better idea on the work you've been doing, but also just tie together a lot of why you and I are in these worlds and why we talk about the stuff that we do. So before we get into a lot of the work and the research that you've been doing, I want to learn more about you. I know a little bit, but I also want our guests to learn more about you as well. So sometimes this is the trickiest question that I throw out to people, but how about as the starting point, you do your best to wrap up your life story leading up to what you do now as best you can. So really just anything you think is relevant about younger Bryn, your education path, your career path, before you get into Striped and that stuff, because we'll spend some time talking about that.
All right. Yeah. Well, I'm a public health scientist and I specialize in adolescent and young adult health. But actually, I began my career in journalism, which was a very exciting line of work to get into right after college. So I love doing that. I love journalism, but at the same time, I felt science pulling on me. I loved science. I had studied that as an undergrad in college. And I also wanted to make sure I was committing my work to do good, to be out there helping to make healthier communities for people, give everyone a chance to grow up healthy and be able to put together a good life for themselves. So that's really what led me to public health, that commitment, the love of science. And so I went back to school after working in journalism for about 5 years. I got a master's degree, a doctoral degree in public health to become a scientist. And I've been working in the field for the last 25 years.
Yeah, for sure. You've done a lot as well. There's a couple of things I applaud. Number 1, you felt this passion inside of you and you followed it. A lot of people feel that in their gut and they don't take that shot. I'm glad you did, because you've got a lot of good work out of it that's doing a lot of things for the greater good. As you said, that's the other thing that you had pulling, and we're all happy that you went those routes. And one of the things that you started is Striped, and that's going to be the focus of our conversation for the most part today. So I'm going to put that to the side for just a second, because I alluded at the very beginning that there's lots of titles that I could call you, and I want to give you a chance to talk about all the different things that you have your hands in, I guess as high level as you want to. But honestly, you kind of already mentioned it. I could have called you a research scientist. I could have called you a professor, because I know you work at Harvard. I mean, I'm sure there's a couple other titles I could throw out at you. So what other things do you have your hands in before we kind of evolved into Stripes and some of the research you've been doing there?
Yeah, well, I'm a professor at the Harvard School of Public Health and at Harvard Medical School, and I'm a research scientist over at Boston Children's Hospital, which is just down the street from
Yep.
the Harvard School of Public Health. I'm in the division of adolescent and young adult medicine, so I get to work every day with folks who are really committed and passionate about helping young people grow up healthy and ready to take on the world.
It's great. You did a really good job summing that up too, because when I was looking through all your information online, I was like, oh man, we could do a whole episode just talking about everything that Bryn's got her hands in. So well done on that, and awesome all the work that you're doing. Honestly, when I asked that question, I was like, I should probably get a second job. I feel pretty unaccomplished talking to you, but I'll work on that on my free time. For now, thanks for all you're doing, and that sets us up perfectly, really, to evolve this talk into Stripe specifically and some of the issues that you've been tackling in that group. But let's start by letting our listeners in on what that is. So Striped, I'm gonna make sure I get this right, because it's a great acronym, but it stands for Strategic Training Initiative for the Prevention of Eating Disorders. I think I got that one right.
Yeah.
And you've been doing that for a while. You founded that a little while back. So let's just start with the high level question there. Why did you start this group? I'm sure it related to that calling of wanting to do good with your career. And what is the overall mission of Stripe? What are you trying to accomplish with it?
Yeah, Striped is a research and training program. It's based at the Harvard School of Public Health and Boston Children's Hospital. We train public health professionals and doctors, nurses, psychologists, people in different clinical fields who want to specialize in adolescent health or public health, we train them in how to bring public health methods to advanced eating disorders prevention. So our mission is to train the next generation of health professionals to harness the power of public health to prevent eating disorders and related problems with food, weight, and appearance. And we strive to create a society where children of all genders can grow up at home in their own bodies. When I started in the field about 25 years ago, there was almost no one from public health working in eating disorders prevention. And that seemed like a real missed opportunity to me. And in public health, we've had some momentous successes over the past century in improving health of whole communities, the whole country. If you think about preventing cancer, polio, reducing injuries from, or how serious injuries might be from car accidents, public health had a hand in all of this. So I figured, why not bring some of that great big picture thinking of public health to eating disorders prevention? And that's why I founded Striped in the first place about 15 years ago. And we hit the ground running to bring public health solutions to these kinds of problems, and we haven't slowed down since.
Yeah, it's, when I said what the acronym stands for, to me, I really think the most powerful word is prevention. I mean, that's the world we live in. We believe in prevention through education. And I think so much of our healthcare and all our system is reactionary when we're so much we should be trying to get ahead of. And this is one of them. We should be discussing these things because they are issues that are facing so many people out there. And that's what I think is to be applauded about the most is the goal behind that and the prevention mission that you have. And I'm just kind of curious because it sounds like for the most part, it's really a train the trainer setup, which is super powerful. I mean, that's why when we are on the road, we talk to students, but we also try our best to talk with parents and coaches and athletic trainers and school nurses and people that are working with students on a regular basis so they can have those conversations. So if that's kind of your trickle down setup, what are the tools or the formats that you use? Like, let's say I'm someone that wants to learn more from you about how do I prevent these issues? How do I discuss this stuff? Do I come to your website? Do you train people in person? Are there programs that you run them through? What's the logistics of how that ends up working out?
Yeah. So we do a lot of train the trainer, as you put it, that is training the next generation of health professionals. We also do a lot of research. So our research, we specialize in policy relevant research. So we look at policies and what's important, where are there opportunities, and we design studies to try to answer the question policymakers need in order to put good new programs, good policies out into the world. So this is something that we bring in that's a little bit different. The way that eating disorders prevention had been approached before we came on the scene was led by clinicians, which is great. I mean, they're really the frontline responders. They were the ones seeing the devastation of eating disorders on young people, on families right from the start. So they knew they needed treatment, but they also didn't want to stop there. They wanted to get into prevention. And they did this. They did this basically by using the tools they had, what they've been trained in, that are really designed for one-on-one treatment and kind of retrofitting it in a way to make young people more resilient to a toxic environment. Well, from public health, we really come at it from a different perspective. We start by thinking about how do we change that environment? How do we make the environment healthier so we don't need kids to just be more resilient? We're not putting them at risk in the first place by cleaning up that environment. I like to use an analogy, think about like air pollution. So if we had an area that all of a sudden had a lot of air pollution, maybe from smokestacks or traffic or something else that was causing that, of course, we'd want to protect people right away. We might have people wear masks or gas masks or something that's putting them at risk immediately. However, we wouldn't stop there. We wouldn't just like issue kids a bunch of gas masks and say, okay, go out
Good
for
luck.
recess or play your sports with the gas mask on. No, we would go in and say, okay, so how do we clean up the air? Well, when it comes to the kinds of pressures on body image that kids face, the appearance pressures, that's like having a toxic environment. It's all around them in media, in their relationships with others, in the consumer environment, the messages they're getting at school, sometimes at home, and all around in their lives. That's a toxic environment in a way. Now, when we prevention efforts that are just about making kids more resilient, that's the equivalent of issuing gas masks and saying, okay, go out and play, live your lives with a gas mask on. That's not what we want from public health. What we want is to clean that up by looking at ways we can create healthier environments for kids to remove some of those toxic body image pressures. So that's our starting place with Striped.
Makes a lot of sense. I'm sure it's a difficult mission to accomplish, but it's easy to just say, hey, here's a problem and here's a temporary solution, and let's just kind of turn our eye and hope it gets better. That doesn't end up working in the long run. So it takes a lot of work behind the scenes to, like you said, change the environment in the first place. And that's where I know you've done so much research in these areas to help kind of get some momentum behind that, show what the problem is, discuss solutions. It helps that you're a research scientist, so you can do that within the Stripe format. And all of that makes a ton of sense. In fact, I want to talk about some of that research, but before I get to that, I actually want to spend more time on the root problem that you were just mentioning, because the two key words that we say every time we talk, and I know you live within it, and I know everybody lives with it, is body image. It's just, it's such a universal pressure. And I don't know that we can act like we can eradicate that type of pressure. I don't know that that's an achievable goal, but we can be a lot more aware of what's going on, and that it is a serious root issue, and it is causing people to feel the need for disordered eating or feel the need to use products. So I guess I'm curious, from someone that's been in this world even longer than I have and done research in this field, where do you think the root issues are coming from in regards to body image? I'm going to guess from talking with students that your answer might be pretty related to social media and imaging. I mean, that's got to play a role in it. But I also know this pressure existed before social media did too. So what are you seeing as the root causes that are causing these issues that you're trying to prevent through Stripes?
Yeah, well, certainly social media has made everything a lot worse. But the body image pressures, especially on girls and women, have been around for a long time.
Yeah.
And a lot has been written on what the origins might be. They may go back decades, centuries in some ways, but we don't need to talk about all that history. I would say just more recently, and certainly in our lifetimes, a lot of it is about who's going to be able to make money off of this. You make consumers feel bad about their bodies, give them a solution that's some kind of commodity or service that they have to pay money for. Somebody's making money off of that. They're making money off of making us feel bad about how we look, how we dress. The girls and women, there's so much pressure around the makeup, even starting very young, all of that. This is being driven by profiteers, basically. I would say that. Now, where social media comes in is amplifying this just exponentially. And we know there's been pressure, as I mentioned, on girls and women for a long, long time. And the unrealistic standards of beauty and appearance norms have pretty much continued. There's been a lot more pushback around girls and women, but what people haven't been as aware of is how much pressure there is now on boys. That's been building over the last years, couple of decades. And with social media and introduction of social media, that's just gone through the roof.
Yeah.
With the amped up pressure on them to basically get muscular. Now, the way this gets to young people through social media now is that they are really quite literally being stalked through their own phones by algorithms. And I'm guessing your audience has by now heard that term of algorithms. That's the computer code that basically programs everything that shows up on your screen, on your phone. Well, these algorithms are designed to basically stalk users or kids on social media to grab their attention, to suck them in, and to keep them online longer than they were planning to be on, or that is healthy. And many young people know it's not healthy to just stay online scrolling and looking at all of this, but they're sucked in because there's some pretty smart people, unfortunately, coming up with the tricks of the way the platform can suck us in. These are really powerful. And even if a young person doesn't want to get hooked in, it's really hard not to. So why do the platforms do it? It comes back to the money again. It's the heart of their business model. They literally monetize users' time online. So with the more minutes, hours a young person or any aged user on social media is online, that is money in their pockets. The platforms are selling that time. They can get more money from advertisers for people who are staying online longer. Every additional minute is money in their pocket. And
we're not talking about little bits of money either, right? I mean, we're talking massive amounts of money being made.
Exactly. And in fact, I did a study released last year where we were able to estimate, well, how much money are these platforms making off of kids? We looked at the big 6 platforms in the US. It's Instagram, Facebook, TikTok, Snapchat, and at the time it was Twitter, now X, and YouTube. We estimated that they're generating nearly $11 billion in revenue from children online, ages 0 to 17. And that's 1 year of revenue. That's 2022. $11 billion in a single year. These are astronomical revenues that they are bringing in. They don't want to change anything. They want to keep doing exactly what they're doing, those platforms.
Yeah, and then we wonder why we have such a high level of body image pressure, and we have kids younger and younger feeling that pressure. I mean, one of the things you mentioned before, and I'm even so sensitive to it, is like I have an 8-year-old daughter, and she like wants to buy makeup, and I'm like, where did that come from? I'm not pushing that out, but it's like almost unavoidable, the messaging, the imaging. I mean, she doesn't own a cell phone, right? But it's and so imagine if you do own a phone, how much of that you're getting on a daily basis, and it's just compounding, and it's just, I don't know. It's an issue. Social media it's tough because almost like a necessary evil at this point. I mean, like we have a podcast. How else are we going to let people know that we talk to you if we don't put it on social media? But then we're talking about the harm that social media does on the back end. So it's a tricky thing, but you're right. With that amount of money, I don't see it changing anytime soon. And that study is interesting. I had not seen that one on the money that you did. I did see a couple other ones. There was one that I read. You sent it to us a little while back. It was called Diet, Pills, and Deception, I think was the title behind it. And you looked, again, kind of into social media, the promotion of these harmful, like dieting related products. Give us some more background on that study. Like, how was it set up and what were the results that you found from that one?
Yeah. So we did a study recently looking at social media and what the kind of messages are that young people are getting. So people are talking a lot these days about how much dreck basically is promoted to kids through social media. Often the parents have no idea because the algorithms pushing content to parents totally different than the algorithms pushing the content to their kids. So unless they're looking at their kid's phone, they don't know what their kids are seeing. So our research team, led by my colleague, Dr. Amanda Raful, decided to take a deep dive into TikTok and see how diet pills, over-the-counter diet pills, and muscle-building supplements are being promoted through some of the most popular hashtags, such as hashtag diet pills, hashtag pre-workout, hashtag detox. So we analyzed over 200 TikTok videos with these hashtags. And what did we find? When we analyzed the videos promoting these over-the-counter diet pills and muscle-building supplements, we found 94% of the people posting them did not even bother to provide any credentials whatsoever as to why they should be speaking on this. 96% of the people posting these did not disclose if a company had paid them to promote the product. I mean, you'd think if somebody was promoting something just out of the goodness of their heart and not because they thought they were making money off of it, they'd probably say that. They'd probably say this was not paid for, but they don't. They just are not disclosing. You know, they're supposed to, by law, they're supposed to say when they got paid to promote a product, but 96% did not disclose that. 97% did not provide any evidence whatsoever to support the claims they were making about the benefits of these products that they are trying to get kids to buy. So in a nutshell, what we found basically is, TikTok is a pipeline to feed kids a whole lot of dreck, deceptive dreck, from a lot of people who are trying to make a buck off of deceiving kids around body image to get them to buy these sham products online.
Right. And if they see it online, it must be true. Right. I mean, now you can buy yourself a blue check mark, make it look like you're certain you know exactly what you're talking about. Right. That's why I asked, because I get questions from kids every single time I do a presentation. And I mean, listen, half the time it's new information to me because they ask me about products that they're seeing. Because like you said, my algorithm's probably different than theirs. And that's where I learn a lot about what they're seeing and what products are being pushed on them. And they ask with legitimate questions like, hey, someone told me about this, like I've been trying it. And I'm like, well, what made that person have any credentials behind what they told you? And most of the time they don't. But how do we blame kids when that's just what they see and that's their source of information, right? Like it's tricky when information like internet and social media is our source of information. How do we combat that? It's so difficult when all of them are connected, right?
Yeah.
Like the easy answer would be like, let's be disconnected, but that's not a realistic one too. So that's part of what I know you're fighting through with Striped is like, we can't necessarily eliminate all this, but we've got to put some more regulation in place. Like we've got to have some more guidelines here and actually enforce them. Like you said, like the laws are there where they should state these things, but they don't, and it's not stopping them. Right. So that's tricky part that's adding to all this. There was another study that's just, all of this is just compounding all these studies like that I've read that you've done. It's just all goes so hand in hand. In fact, the one that you sent us most recently, I'm looking at it right now, was really interesting because it was a long-term study. You were linking kind of anabolic steroid initiation to people, specifically, I think it was specifically males that had been using muscle building supplements, right? And kind of showing that those supplements were perhaps an initiation into the world of anabolic steroids. So set us up for that study, right? Like, how did you do it? How long did it take? How did you get the results, and what were the results?
Yeah. Thanks for asking about that study. That one just came out last month, even. Clinicians have been suspecting for a long time that when kids start using muscle building supplements, that might be sort of a gateway substance in a way that will lead them, or some kids, to start using steroids. People are hearing that, they hear it from the gym, they hear it online, that steroids will get them the body that they want. And it's a misguided and really dangerous efforts to ramp up muscle gain when they switch over to illicit or illegal anabolic steroids. Now, people have suspected this for a long time, and it actually seems logical, but nobody had directly tested it. That is, nobody had designed the right kind of study where you follow people over time and you just see, what are they doing? What do they not do? What do they start doing? So we decided, well, we got to put this to the test. And so we designed a study to do that. We've worked for a long time with a survey of young people in the US. It's been going on for decades, really. It's called the Growing Up Today study. And through working with this group of young people, which is enormous, thousands and thousands, we were able to follow over 4,000 teen boys and young men over a 14-year period. We surveyed them 6 times over that 14-year period to ask them about their health, their use of muscle building supplements, or use of steroids, and some other things. What we found really shocked us even. Boys and men who started using muscle building supplements were over 8 times more likely to go on to use illegal steroids for muscle building within just a few years compared to peers who had never used muscle building supplements. And we thought there'd be a connection, but 8 times is massive. That is a massive increased risk there. And our findings make it pretty obvious that there is a connection there. I mean, I think probably lots of people had suspected that connection was there, but this is the first time we're really able to show it with hard evidence. And it's boys and young men who are paying the price. I mean, we do see some use in kids of other genders, but boys and young men are the ones most targeted and are using them the most. And they're paying the price given the many health and mental health risks of steroid use.
Yeah. I mean, we've done episodes on all the harmful side effects of anabolic steroid use. People can go dive back into that. And, you're telling me about this. Even when I was reading the study and you sent it to us last month, I got frustrated with myself because I found myself not surprised. Right. And I wish I was. I wish I was surprised, but I'm not, because maybe I'm in this world and I've talked to enough students that just, get into the supplement space. We get pushed into it because of all the things you and I are talking about. And then when we get pushed into that space, a lot of young people think, okay, this is the answer, right? Here's my magic powder. Here's my magic pill. I can take this. I can get to who I need to be. And that's not real. That's not really how it works. If you're taking a supplement and it is creating drastic change in your life, I wouldn't take that supplement. There's clearly something wrong with that product, right? But we're looking for quick fixes. We're looking for answers. We don't get it there. Well, one of the problems with anabolic steroids is they're effective. They're powerful drugs, right? And if you don't have a young person that knows the cost to that decision, and the downside to that decision, and they're just looking for answers, well, there's one that could actually get the job done. So we're just, all of this pressure leading us into the supplement stores, that's leading us to that. I get frustrated with myself sometimes that I'm like, I wish I wasn't surprised, but I wish I was more surprised.
Yeah,
honestly,
right.
By some of this. It's tough. I actually saw some of this play out. One of the things you and I have been talking about recently, I don't know if you got a chance to watch the documentary called Generation Flex. It was put together by our friends at Men's Health. Shout out to Men's Health. If you haven't watched the documentary, it's great. It's like an hour long. You can just go to their website. You can find it. We just hosted the premiere in Dallas, but I know you and I were talking about it before we even released it. And it's just a great example of young people feeling the pressures that we're talking about, getting involved with the supplement space, not really thinking about the cost of that, and then them looking back and reflecting on all of that, and thankfully for the most part coming through. Although one a student passed away from, caffeine products they were talking about. So I was curious because I know we were talking about, did you get a chance to watch it? How did that hit you when you sat down and watched it? Because it just really related to me because of the students that I talk to on a regular basis.
Yeah, I did see Generation Flex, and I was so impressed. I was so moved by the film, and the filmmakers did such a tremendous job with how they were able to drive home some of these urgent points about the risks of muscle building supplements, the deception out there, the unacceptable weaknesses in how our government protects or does not protect consumers. But they didn't do it in a lectury way. They weren't
Yeah.
condescending about it. The way they did this is by letting real people tell their stories, real young men, their families, letting them very courageously tell about their own experience in their own words, what the effects were on the bodies, how they got sucked in, what kind of deception played on them to get them to start using them or their friends to start using them. And through that, through that, we realized, wow, there's companies out there, there's promoters online and gyms who were really taking risks with these young men's lives. Derelict companies, they're deceptive. They're letting people think the products are effective when they're not. That's the muscle building supplements or protein powders. They can be downright dangerous, but that's not what this message is that kids are getting online. What this film brought us through was, what are the kids hearing? What are they experiencing? Why are they making these choices? And who's really behind it and profiting from this? These young men and their families had so much courage to speak out and really speak truth back to
Yeah.
these kind of predatory companies and the effects they've had on their lives. I recommend Generation Flex to everybody. And now, as you said, it's streaming now.
Yeah.
So really anyone can see it. You can find it online. Anyone who cares about the health of teen boys, their families, coaches, other adults, or people want to know what's wrong here, what we can do about it. This is the film to watch.
Yeah, I'll put a link to it in the show notes because I totally agree with you on the tone of it. It's not a scare tactic. It's not an anger, driven documentary. It's just exposure. It's just awareness. That's how I try to talk to young people too. When I go to a school and I sit down with people, the first thing I tell them is like, listen, I'm not here to yell at you. I'm not here to get mad at you. I'm not here to judge you. None of that. I just know, I empathize the pressures you're feeling. I know how overwhelming all of this, is. And I know you're in these worlds to whatever extent that it might be. Let me give you some information that might help. And that's what I actually find, like, a lot of our young people like are looking for actual information, right?
Mhm.
They get so much information on their phones. They're not sure what's true or not. I think they're actually kind of thirsty for a lot of this, but there's not enough people out there talking about it. That's why I like that film and appreciate Men's Health for putting it together, because it's just another tool to get people talking about it. That's what's really needed with a lot of this. And that's what I applaud you for what you're doing, is like getting people talking about it, making awareness out there of what the issues are so we can kind of work towards solutions, which is where I want to take this discussion with you next, because we've obviously established a lot of the issues at play and talked about your research, but I also know on the back end, you are working on solutions and you're doing an awesome job with it. In fact, I think the first time you and I ever got connected, we were talking about some of the legislation that you were trying to get in place around supplements, right? And to give you massive props, you actually got this legislation through in the state of New York. And to give people a little bit more information on what it is, you were able to ban the sale of diet and muscle building supplements to minors, anyone under the age of 18 in the state of New York.
That's
Bryn,
right.
Oh,
Yeah.
okay, you're still there. Sorry, you were frozen on me for a second. So you were able to get it set up in the state of New York where anyone under the age of 18 is not allowed to buy, muscle building or diet supplements for themselves. All right. So I'm curious, how did you get this passed, number one? And then
Yeah.
just tell our listeners a little bit more, like, what is the legislation? Like, what is it? How is it stated? How is it put into play?
Yeah. Yeah. So yeah, we're thrilled when that was passed into law in New York. I mean, where it came from is many years ago, I was talking with colleagues about all the evidence we had that kids were buying these products in stores and using them, and the links with eating disorders and body image struggles and the health risks. And this colleague of mine in the audience raised her hand and she's like, well, why don't we not sell them to kids? Somebody's out there
Yeah.
selling these products we know are having health risks on kids. We know they're exploiting their body image, mental health struggles, the pressures on them. Why don't we put in a new regulation to prevent them from being sold directly to kids. And it was like a light bulb. Oh, we don't have to just watch the world go by and document what's happening. We can actually try to intervene here, change policy, make common sense decisions around protecting kids. Now, we've done that with tobacco. That's a no-brainer now. We don't sell tobacco to kids.
Right.
Why sell them these diet pills, these muscle building supplements, when we know they don't work, they don't achieve healthy weight loss or healthy muscle building or strength training, and they can be downright dangerous because they are so poorly regulated. These products, again and again, have been found to be laced with undisclosed pharmaceuticals, drugs. Even Viagra has shown up in some of these muscle building supplements without being disclosed, and it doesn't belong there. Illicit steroids. We know illegal steroids are showing up in these products. We know stimulants at such high doses that they can be deadly are showing up in pre-workout or other muscle building supplements. We've known this for years. So it's really common sense. Why sell them directly to kids? Kids shouldn't be using these products. We don't have to sell them. New York state lawmakers said, okay, enough is enough. We have this new age restriction. Adults can still get them. We don't advise that people use them, but adults can still get them. But we don't want these companies profiting from deceiving kids into buying these products.
Yeah, and for those listeners, I mean, I'm sure people probably know this, and we've done previous episodes on this before, but yeah, and I can link back to previous episodes that talks a little bit more about how the dietary supplement industry is set up. There's clearly regulatory issues there, but at the end of the day, there's no required testing on supplements before they hit shelves. So it does, like Bryn is saying, sometimes lead to products that get contaminated or adulterated on purpose with some pretty risky ingredients, right? And so that's kind of what we're talking about, and the reason why there's got to be a little bit more regulation in place, and that's what this legislation is doing. When I first was reading through this, I have one quick question for you because again, I live in this world on a pretty regular basis, and I know we're at the point now where, gosh, last time I checked, there's 80,000 supplements on the market. I mean, it's so overwhelming. I can't keep up with everything that's out there. How do you go about defining those categories? Because that's going to be the trickiest part, and probably not the diet category. I mean, I could probably spot one of those pretty quickly, and I'm sure most people could. But let's take like muscle building supplements as a whole. That can be a little bit trickier, right? Because I can look at something like a whey protein that has some intrinsic muscle building properties to it. That's just what it does. It repairs tissue. And I guess I could call that a muscle building if I wanted to, but I guess that's not on the list of what's banned. So how do you kind of draw those lines around, all right, here are the specific products that if you're under 18, you can't buy?
Yeah, well, we can start by looking at what the U.S. Food and Drug Administration does in terms of how they categorize the products. They distinguish very clearly what's an over-the-counter drug that might be like an aspirin type product, what's food, a loaf of bread, and then what's a supplement. Prescription drugs are a whole other category, nothing to do with this. So supplements are labeled clearly as supplements. You can actually, anyone out there in the audience can just pick up a bottle or a package of food or something you have nearby, turn it around, look at the label on the back. There'll be a really prominent label that lists, that might list ingredients, can list calories for food. Right at the top of the label, it'll say nutrition facts if it's being sold as food, and it'll say supplement facts if it's being sold as a supplement. So you mentioned whey protein, and that's one that often is confusing there because people think of it as something that's for muscle building, but a lot of times whey protein are actually sold as food. They're sold with the nutrition facts label. That's how you know. We're not as concerned about all the illegal, undisclosed ingredients in products sold as food. Although certainly someone could argue we don't need these protein isolates, these highly processed kind of versions of proteins. Just eat some chicken. Eat something else that's got protein in it if you need to increase your protein. Usually Americans eat a lot more protein than they need. But anyway, a lot of the protein powders are sold as food. The law in New York does not cover those. It's not about that. It's about the supplements because it's the supplements category. So again, it's a product turned around, says supplement facts, you're holding a supplement in your hand. Very clear. That's the product line where we're seeing again and again this kind of deliberate lacing of these products with illegal ingredients, dangerous ingredients. Viagra, I mentioned, illegal steroids showing up in these, excessive stimulants. In fact, stimulant doses that are so high, even the U.S. Department of Defense does not want active duty soldiers using these products.
Yep.
More than a decade ago, they created Operation Supplement Safety because some of these products were killing our own service members out in the field. We had people deployed in conflict zones who weren't dying from that conflict. They were dying because of the supplements sold to them, where they were getting such excessive stimulants or other dangerous ingredients that it was killing them. That's what moved the Department of Defense to take action. And yet these same products can be sold to any 12-year-old with some cash in their pocket or a credit card almost anywhere in the country, except New York now.
Right. And I know you're pushing it in other states, and hopefully they follow suit. I guess on my one follow-up question on the logistics of it, because my own ignorance here on like how's it going to be implemented? Like, does it assign to certain products where like if it's scanned at the register, it's like, hey, check ID, or because like, or you're just not allowed to, go into GNC as a whole if you're under 18. Like, you just anything there, you'd have to get it because like I would imagine like 16-year-old could buy a vitamin if they wanted to, but it's just these categories that they can't. So how is it enforced? Maybe that's the right word I'm looking for.
Yeah. Well, the law went into effect in April of 2024 in New York, and we went into stores, and actually we work with a lot of youth advocates who are passionate about this, and they've been doing spot checks on stores in New York. What we found is that right away, stores were taking these products and putting them in locked cases as they were supposed to. And putting them behind the counter. And they need to check ID. And the young people who wanted to test this, high school students in New York wanted to test it, they went in and tried to buy the products and they had ID checked. So we know the stores are enforcing it, and they started enforcing it right away.
Okay.
And I just want to add that this applies to both brick and mortar stores and online. So it's not like then a kid can just go buy it on Amazon. Amazon in April of 2024 also put in all kinds of additional restrictions, particularly on the weight loss and muscle building supplements, because they knew it affected them, and what they could sell to kids in New York changed because of this law.
Makes sense. All right. So they're kind of put in their own spot in the store. All right. Well, then that leads me to my final kind of question on some of this legislation, because my own curiosity got the better of me here. I have just got to assume that you're getting pushback, probably mostly from companies, right? I mean, because let's go back to our initial conversation about social media and how much money they're making. Like, there are people pushing back on them. You and I are one of them, but there's plenty of other people. But again, like, likeliness to change? Probably not. There's so much money being made. Well, the supplement industry is not that different. We're talking about $45 billion industry, right? There's a lot of money being made. So what kind of pushback are you getting? Is it coming mostly from the companies? Like what are you hearing? I got to imagine that's like the hardest part is people that don't want this to change.
Yeah. We're getting a lot of pushback. Yeah. No story there. That's
right.
Kind of what we expect. This is how they act. This is what they do. So they do it in different ways. They will lobby state houses. They go in and they'll tell all kinds of lies every which way to Sunday to lawmakers. One of the things I've learned early on from someone I know who works in lobbying or advocacy around health issues is that when your opposition wants to change a law, they'll be very aggressive in lots of ways. But when an opposition wants to keep the law the same, so in this case, the companies want to keep the law basically very weak and toothless. That's what they want. All they have to do is confuse lawmakers. So we had lobbyists from the industry telling lawmakers that our true goal was to ban Flintstone vitamins or to ban milk and chicken in children's school lunches. I mean, it's absolutely absurd. But I know at first I was really confused. Why are they saying stuff that is so preposterous? But what this colleague explained to me is that all they have to do is confuse lawmakers, and they'll be like, oh my gosh, I'm going to take on a much simpler issue. Forget it. Maybe this is important. I don't know. I can't figure it out. I'm going to do something else. That's all they're trying to do. Because every year they can keep lawmakers from acting is another year of that $45 billion in revenue that this industry is bringing in, if you count all of the supplements industry together. So they do that. They basically go to state houses and sham lawmakers with their made up as if facts that are not based in truth at all. What they also do really concerns me as a scientist is they will get people nominally with some kind of research credentials to publish articles basically spewing their party line, their company line. Oh no, there's no problem here. These are fine. We can use these. These are good. They're effective. Just don't look over there where there's all this research. Well, what they do is then the lobbyists go in and they say, oh, so-and-so published this in this scientific journal, and therefore it must be true, and just ignore all the other evidence.
Yeah.
That's something that tobacco has done for years. And some of the other industries like that have done that for years, which again brings in confusion, injects doubt in the minds of lawmakers, and then it's over. Then we got to just come back the next year and try to get lawmakers to do the right thing. So these are the couple of kinds of things that they're doing. I'm certainly not their most favorite person now these days, but it's good work. And I've got lots of friends like you and the Taylor Hooten Foundation and others who really are passionate about this. And we're not going to drop the ball on this. We're going to
Yeah,
keep
well,
pushing.
change isn't
Yeah.
easy. I mean, you can look back at any point in history and see where, anybody that made positive change had opposition, along
Yeah.
the way. So that's just part of the territory, I imagine. But, I applaud you for that, because I'm sure that's the toughest part is, especially when they use the misinformation. And that's what's so frustrating. Like, even with the kids and the products and the influencers, and the misinformation is kind of a theme with a lot of the stuff we're talking about. But it's crucial. We have to keep fighting through. When I start thinking about supplement industry as a whole, like, I get this question a lot. People, when I tell them how the industry is set up, and it's amazing how many people don't know that. A lot of the question I'll get is like, Brian, do you ever see this changing? Right? If this is how it exists, and like if this is the amount of problems that it's causing, and this is the risk of the product, do you think this will change? And this is, again, I catch myself frustrated, and my gut tells me no, which is tough, because it's like we're working off of laws that were passed in 1994 when the industry is completely different than it is right now. And then the other side of me is like, no, I think it will, but like more people have to be aware. And so I'm curious, like, from your point of this, because you're in this space too, probably even deeper in so many ways than I am. Do you ever see it changing? Like, do you think we can get past this pushback, this misinformation, like past all this lobbying and this money being made off of this, and get to the point where the industry is set up with just better laws and regulation in place? And if it does get to that point, how do we get there? Are you like me, where you think it's just got to come from awareness as a whole? If we can get more people aware of the issues with the whole industry setup as it goes, maybe that's the start. Because right now people still think health food stores, legal, no risks here, right? I'm in a safe space. They may not know the risks involved. So maybe awareness, that's the starting point. At least that's what I tell myself. But I want to hear your thoughts as well.
Yeah, well, certainly awareness is important. And this industry is pushing out this idea that they're under a health halo, as we call it. Like anything they do is fine. It's healthy because they say so. Well, we know that's not true. And it's a charade that they're sucking people into. So we do a lot around education, and we're so grateful for all the education work that you do and what you do day in and day out to give young people and the coaches and families the information they need that they're not getting online otherwise, unless they know to go to the Taylor Hooten Foundation. This is what people need. But that's not all that we can do. There's a lot more we can do, and we proved it in New York. We started working in New York a few years before it became law, and we started working with young people directly. There are lots of high school students out there, some middle school students, who are very passionate about this issue. They've seen the harm done to their peers. They feel preyed on by these companies, and they've had their friends be injured. And sadly, in some cases, some of the youth we work with, they've lost friends who died because of some of these products. Well, these kids are passionate, and they are willing to do what it takes to lobby the legislature to educate lawmakers about this issue and getting common sense protections for kids on the books. And that's why we were successful in New York. Great crew of youth advocates who talked to their representatives. They talked to the head of the New York Assembly and the New York Senate, and they did everything. They were willing to be there, and they testified, they told their stories, and in the end, they moved mountains. These kids moved mountains, and that's why the law has changed in New York. And I'd like to say that is probably why Amazon responded. I mean, Amazon is a behemoth, but they
Yeah.
saw what was happening in New York, and they proactively did what they should have done a long time ago and start to put more restrictions on these products. Well, what we're seeing in states all over the country now is young people there passionate about this issue, and they are taking it to their own state houses. So we support them in lots of ways and helping them learn. One, lawmakers actually do like to hear from kids. It helps them feel like they did something good that day when they hear inspiring kids tell their stories. And there are many lawmakers who do want to make a difference in their states. So often in public health and with other good causes, we need to go city by city or state by state first, kind of demonstrate this can be done. This is how it can be done. This is what the effects will be. And once you get enough momentum, that's when you might see change at the national level. So we're at the stage now where we're working at the state level because we know this is how you make change happen. And we've got youth out there that inspire us every day with this advocacy.
Yeah, the trickle up method probably makes more sense than just saying, "Hey, let's just go try to change the
Yeah.
the national law tomorrow." That's not going to happen. But yeah, you're right. Stories are powerful. I always struggle with that a little bit because it's like I can look at our foundation, like we're founded because of really a tragic story. And sometimes I get frustrated, like, is that what it takes for people to listen sometimes? Like, can we not just get ahead of things before the tragic stories happen? And maybe it's got to be a combination of both. But, you know, yeah, the younger generations is the key, right? Like if they can get on board, and most of that's going to start with awareness, right? That probably will get us headed in the right direction. And the work you're doing and the legislation you're getting in place, it's amazing you can even get that through. I mean, that's heading in the right direction, but it takes a village for sure. And hopefully, we keep that momentum going. It leads me to one of my last questions, and honestly, I don't even know if this is a fair way to end this because it's such a difficult conversation to have, and I try to have it with students, but it's so personal, it's so hard. But I've talked to enough people to know that there's probably going to be people that tune in just this conversation right now that may be feeling the weight of a lot of stuff we're talking about, right? That may be on phones and feeling like they got to look a certain way, or maybe fed product information on a daily basis. Maybe they're thinking about disordered eating as an answer or looking into supplements as a quick fix, and who knows where that takes them. I talk to students that are dealing with this all the time, and one of the things I try to incorporate into my presentations is some positivity behind who they are and just letting them know that who they are is who they're supposed to be, and whoever they are is enough. And I always feel like it's an inadequate conversation that I'm having, but I also feel like it's super crucial because they don't hear those words from enough angles. And so I just want to give you the opportunity to any messaging like that you have that you might be putting out there, because you're in this space, right? You've been in it more than me, and you're making a lot of positive change within it. So anybody that's tuned in that might be living in this and feeling this pretty personally, like, I just want to kind of wrap up with my thoughts on that I just gave, but also any thoughts that you have, for people that are feeling that.
Yeah, I definitely want young people to know, and the people who care about them, families, coaches, teachers, the folks who care about them, we can make a difference. And young people, your voice needs to be heard. If you feel like this is something you want to change in your community, you don't want your friends or yourself stalked online by these companies. You don't want you see your friends taking risks with these products. We can work together to make a difference. I encourage folks who are interested to get in touch with Strike. We work with high school students from all over the country and some college students also. We work with folks all over the country, and we will help you make sure your voice is heard, that your story gets out there, and that you're doing something to change this. For parents out there, make sure you're showing your kids you love them for who they are, that what's important is what they're giving back to their community, how they work hard for things they care about that will make a difference for their communities. It's not about how they look. It's not about who's got the biggest bicep. It's about what are you doing with all the gifts that you have through your body and that you were given. Being on this planet, we've got a short time on the planet. How do we give back to our communities? How do we show we care? These are the really important messages that we need to be getting out to kids. And at the same time, doing what we can to put common sense restrictions in place on this industry so they can't keep funneling these deceptive messages to kids. And kids are absolutely going to be part of that solution. They are the ones that are going to change the world for us. And we're right there with them.
Yeah, conversations are such a powerful thing. And that's why I wanted to end with at least a brief version of that conversation. And there you go. There's a couple of people right here on your screen that you can reach out to if you have any questions about this. And yeah, I'll wrap with one of the things I started with, and that's just another thank you, not only just for the time today, but for the important work that you're doing. Sometimes we get so caught up in what we're doing and we feel like it's us combating these just massive issues that are out there. But then we get to talk to people like you and other people on this podcast that are, also fighting this stuff and looking for change and inspiring others and preventing issues through education and more. And it's just a breath of fresh air. This kind of just made my day getting to hang out with you. And we've talked before, but I know we'll continue to talk again. But yeah, just thank you for all you're doing and for the powerful studies and information that you're putting out there. It's needed. And I know you'll continue to do it. And anything we can do to help support that, we're always here. So thanks for what you do every day. And thanks for hanging out with me for an hour.
Well, thank you. It's been a pleasure.